Addiction, impairment. What is the first thing that comes to your mind when you hear these words? Initially, what came to my mind is the association with alcohol or drug abuse. This topic can affect anyone, whether it's somebody you know or who has dealt with some type of addiction, even a healthcare professional who has been impaired mentally or physically. From Jennifer O'Toole's presentation, it opened my eyes about the impact substance abuse and addiction has on healthcare professionals, not just pharmacists, and also seeing a new light of how to help those who struggle with these types of disorders. I have only heard of the IMP3 program once before throughout my career as a pharmacy student at Drake, and my reception of the program was that it is a self-entity program that helps pharmacists treat their chemical dependency on controlled substances. Following this presentation, my initial perspective was completely wrong. I was able to learn so much more about what the program does. For example, the program does not treat impaired pharmacists or technicians, but they strictly monitor the individuals through self-reporting, provide restrictions of which providers the individuals can see, and enforce certain regulations on which prescriptions to only take when an individual is enrolled in the program. Something that also surprised me about their presentation was that once individuals have completed their contract, they can extend it to help them in the future to avoid possible relapses or even just to have a sounding board to support them emotionally and mentally. One aspect of the program that surprised me was the interprofessional team that works with the individuals. These professionals include representatives from both Iowa and Drake universities, the Board of Pharmacy Director, a licensed therapist who specializes in chemical and substance abuse, a program provider, and a public member who happens to be a lawyer. Most importantly, I think that the take-home message that Jennifer sent home with me was that the program gives pharmacists a chance to return to practice with safe, reasonable measures and have the possibility of avoiding disciplinary action. Having these types of programs throughout the U.S. allows not only pharmacists but other healthcare professionals to seek assistance before they put themselves or patients at risk.